The following video demonstrates how to identify the tip of a catheter when placing an umbilical arterial catheter utilizing Pocus. These pictures demonstrate the 1 and 2 provider technique for Pocus utilization during umbilical line insertion. The picture on the left demonstrates the 1 provider technique. Here you can see the sterile field extending from the nipple line to the groin and only 1 provider. This provider uses one hand to adjust the central line while holding the transducer with the other hand to guide the line adjustment. The picture on the right demonstrates the 2 provider technique. Here, the letter A represents the primary provider in the sterile field inserting the line, and the letter B represents the second provider outside the sterile field holding the transducer and guiding provider A to adjust the line. First, start by selecting the linear probe on your ultrasound machine, as you see in the video. Then, adjust the depth by pressing the highlighted button. The depth will be based on the baby's weight. Now, place the probe over the lower 1/3 of the sternum with the notch at 12 o'clock. You should be able to visualize the vertebral column. The picture on the right is a midline sagittal CT scan of the abdomen and thorax. The letter H represents the heart, the letter L represents the liver, and the vertical red dashed line is the diaphragm. Throughout the video, the red dashed line will represent the diaphragm. The white arrow at the bottom of the screen points to the descending aorta, and the vertebral column is at the bottom of this picture. The picture on the left is an ultrasound image of the same anatomical section. Next, to adjust the gain, place the probe over the mid-sternum with the notch at 12 o'clock. Then press the highlighted button on the keypad to adjust the gain. These 3 pictures demonstrate the differences between too little and too much gain. The aim is to visualize the aortic leaflets, heart borders, and heart chambers as seen in the middle picture. Next, you need to locate the descending aorta. Place the probe over the xiphy sternum with the notch at 12 o'clock, as demonstrated in the picture. These 2 pictures demonstrate the anatomical configuration on imaging. On the right is a midline sagittal CT scan of the abdomen and thorax. The letter H represents the heart, the letter L represents the liver, and the vertical red dashed line is the diaphragm. The white arrow at the bottom of the screen points to the descending aorta, and the vertebral column is at the bottom of this picture. The solid yellow line here represents the umbilical artery catheter in the descending aorta. The picture on the left is an ultrasound image of the same anatomical section. This video shows how to identify the catheter in the aorta. On ultrasound, the catheter appears as a double parallel hyperechoic lines. Once the catheter is identified, slowly slide the probe towards the patient's head with the notch at 12 o'clock until the end of the catheter, which is the tip, is seen. Then locate the aortic valve, which is the round structure located in the middle of the heart, and you should see 3 leaflets. The tip should be adjusted so that the final location is at the level of the aortic valve, which is seen here by the white dotted line. The next slide will go over troubleshooting in case visualization of the UAC with a linear probe is not feasible. You need to switch to the sector probe, and this may be needed with bigger babies. The gain and the depth will need to be readjusted as well. As the video demonstrates, this is the view to see the UAC with the sector probe in the descending aorta.
Mm-hmm.